From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Our next story is about this medical device which can help patients with heart failure. It is called the Optimizer. It's similar to a pacemaker, looks very much like one, but it works in a different way, in what would be considered for many a revolutionary way. Joining us to talk about it, Dr. Mark Wish, who is a cardiologist at Inova Fairfax Hospital. Dr. Wish, nice to see you again. Now, there's a picture of the Optimizer, and if anyone's ever seen a pacemaker, they're going to say, well, looks fairly similar. It works on heart patients, but a specific population of heart patients. For whom does this work?
Yes. This is for patients with congestive heart failure. That means a weakened heart muscle from whatever cause, coronary artery disease or an enlarged heart, weakened heart, from different causes. It could be chemical, it could be viral. But for people with enlarged and weakened hearts, sufficiently enlarged and weakened hearts, and people who are sufficiently symptomatic, this is a protocol device that is under investigation for increasing the strength of the heartbeat to try to relieve those symptoms.
What you are trying to get is this heart, for whatever reason, isn't pumping very efficiently now, to work a little bit more efficiently, to pump a little stronger, the contraction of the heart to force more blood out of the heart and out to the rest of the body.
It's a pacemaker-like device, but it's not a pacemaker. Right. In other words, this device does not set the heartbeat. It does not set the rate. It does not set the rhythm. It works with the patient's underlying heart rhythm to try to deliver an electrical stimulus to make the heart beat more strongly.
Sometimes these patients with heart failure have heart pacing problems. You can put a pacemaker in to take care of that, but this device could work in concert, or you may not need it at all, because it's doing something different than that pacing protocol.
It is doing something different. This is for the heart strength, for the strength with which the heart squeezes. Now, I want to make the distinction between this device and other devices that are on the market, that are commercially available and FDA approved for patients with congestive heart failure. One such device is the implantable defibrillator. That is something for patients with sufficiently weakened hearts so that if they go into a cardiac arrest or an abnormal fast rhythm, that is something that can then resuscitate them, revive them from their abnormal heart rhythm. There's also a kind of pacing called biventricular pacing, but that's for people who have a very particular kind of abnormality on their EKG, where one side of the heart gets activated before the other, and the heart contracts with a bit of a wobble. That is also a device that is currently available in the United States, but that's only for a minority of the patients with heart failure. This is something different, entirely different, to try to improve the heart squeezing action.
This is investigational. It's in studies right now. Real quickly, what's the response been so far in the patients in which you put it, and when is it likely to get the FDA, one way or the other, to say this is more widely available?
Well, there have been a couple studies in the United States. The first study was basically just a safety study. Inova Fairfax was part of the initial group of about 10 hospitals participating in that study. We're now in a larger study looking at both safety and effectiveness. And we're looking for the company is looking for about over 400 patients to enroll in that study. There have been studies completed in Europe. One of these studies was presented at the recent heart failure meeting that shows that people who got the device, who got the therapy, were doing better.
Very interesting stuff. Dr. Mark Wish, thank you so much for joining us to share it.
My pleasure. Thank you very much.